Hello everyone, welcome back to another session in dentistry and more. Today we have dental veneers. Dental veneers are nothing but part of aesthetic dentistry where a thin layer of enamel from the facial surface is replaced by porcelain, ceramic or any such material so that it looks more fairer or better shade than the existing shade. So we have various types and its indication and contraindications. So dental veneer is a layer of tooth colored material that is applied to a tooth to restore localized or generalized defect and intrinsic discolorations. So it is typically made of directly applied composite or processed composite, porcelain or pressed ceramic materials. So it is indicated to improve the discoloration such as tetracycline staining, stains due to fluorosis or non-vitalized tooth and teeth with darkened shade because of the aging process. And we can also do this procedure on the tooth which is chipped or with fracture, or we can use it for closing the diastema, and also we can lengthen the anterior teeth for a better smile design, and we can go for improving the appearance of rotated or misaligned teeth. But it is contraindicated if there is little or no enamel is present, because it is mainly removing the enamel and replacing the lost enamel with a new material. So in such cases we just cannot go ahead with this veneering. Instead we should do a full crown. And people with habits such as bruxing or clenching or other parafunctional habits like pencil chewing or ice crushing, we should not perform a veneering because it won't last. Because since the patient is having all these habits, it is very easily to chip off or having a breakage. And teeth with severe crowding also, it is not very much demanding. And certain types of occlusal problems, that is class 3 or end-to-end bites, we better avoid this process of veneering. And people with poor oral hygiene or high caries rate. What are the types of veneering? We can have a partial and a full veneer. Full veneer in the sense it is a window preparation or a butt joint, incisal preparation or incisal lapping preparation, how much it is extended onto the facial and incisal surface. We have classification of window, butt joint and incisal lapping. Partial veneers are indicated to the restoration of localized defects. So it is just a partial portion of the facial surface, not complete area. It is just done on areas of intrinsic discoloration, whereas the full veneers are indicated for the restoration of generalized defects or areas of intrinsic stain which involves most of the facial surface. So the basic preparation designs exits for full veneer, that is window preparation and incisal lapping preparation. The window preparation, as you see the picture here, it is recommended for most direct and indirect composite veneers. This intra-enamel design preserves the functional lingual and incisal surface, because it is not going to the incisal or lingual area, which protects the veneers from significant occlusal stress, because that part, the incisal and lingual part, are the area which is constantly under functional stress. So we are purposefully avoiding those areas in order to protect the veneers from occlusal stress. So using a window preparation, the functional surfaces are better preserved in enamel. So the next one is a different approach, that is the incisal lapping preparation. It is indicated when the tooth being veneered needs lengthening, or the incisal preparation is a compulsory, in that cases we just cannot perform the window preparation. We have to do incisal lapping. So incisal defect warrants a restoration. So this design is most frequently used with porcelain veneers because it not only facilitates accurate seating of the veneers on cementation, but it also allows for improved aesthetics along the incisal edge. Based on the type of material employed, we have directly applied composite veneer, processed composite veneer, and porcelain or pressed ceramic veneer. Based on the mode of fabrication, we have direct or indirect. The direct partial or direct full veneers, the indirect veneers are no prep veneer, etched porcelain, and pressed ceramic veneer. So composite veneers are advantages of composite veneers. It is a less expensive one, and we can finish it in one visit, and there is a chance of repair, and the chairside control of the anatomy is possible, and minimal irreversible loss of true structure. But the problem is there's a high chance of discoloration, wearing, marginal staining, and the matching of shade is quite difficult, and it often requires repair and replacement. So the conventional porcelain veneer, the better part is it's very conservative. It offers better color and natural look compared to the porcelain. The tissue tolerance is excellent with less staining. The bond of etched porcelain veneer to the enamel is stronger, and the wear and abrasion resistance is high. The aesthetics are better than any other veneer material. The porcelain veneer allows transmission of light, so it is more aesthetic. But the problems are it is very expensive. So preparation is there. It is highly technique sensitive, and there is a chance of dentine sensitivity. So when only a few teeth are involved, or when the entire facial surface is not faulty, we can go for a partial veneer. Directly applied composite veneers can be completed chairside for the patient in one appointment. The indirect veneers require 2 appointments, but typically offer 3 advantages over the directly placed. They are less sensitive to operator technique, because the main process is done at the lab. So the lab technician is doing the major process, that is the fabrication. Then if multiple teeth are to be veneered, the indirect veneers usually can be placed much more expeditiously. So it has got advantages because when many are there, if it is processed in a single unit, there will be a common aesthetic, common shade, common color gradient. So indirect veneers typically last much longer than direct veneers, especially if they are made of porcelain or pressed ceramic. Now we have the techniques, that is direct veneer techniques and indirect. The direct, partial, and full veneers are there. So the partial veneers are indicated for restoration of localized defect or areas of intrinsic discoloration. So these defects can be restored in one appointment with light cured composite. So this is steps. First we do cleaning, then the shade selection, then we do isolation, removal of the defect and tooth preparation around 0.5 to 0.75 mm. Then we do etching and restoration, that is microfill composite. Whereas a full veneer, direct full veneer preparation, if there is extensive enamel hypoplasia is present, and also in cases of diastema, tetracycline staining, so it can be done in 1 or 2 appointments. First is, as always, cleaning, shade selection, then isolation, the window tooth preparation with coarse round diamond burr around 0.5 to 0.75 mm, mid facially, and tapering down to a depth of 0.2 to 0.5 mm along the gingival margin. Gingival margin should be less preparation compared to the mid facial. After etching, rinsing, and drying procedure, apply the composite. Whereas the indirect veneer technique, it is made of processed composite or feldspathic porcelain or cast or pressed ceramic, and it often requires 2 appointments. So the composite veneers, it requires just one visit. It is less expensive. There is repair potential and tracer control and minimal irreversible loss. So porcelain, we have already seen aesthetic stability, stain resistance, stronger and durable. Gum tissue tolerates the porcelain well. The color of porcelain veneer can be selected such that it makes dark teeth appear whiter. It's not possible with composite. Veneers offers a conservative approach to changing a tooth's color and shape. Whereas the processed composite veneers, in first appointment, what we do is we do a window preparation, and then incisal lapping. If incisal defect is present, then intra-enamel preparation. Then we do elastomeric impression. There won't be any temporization. The second appointment, first we evaluate the fit of the veneer. Then the tooth side of the veneer is priming done. Then after etching and rinsing and drying, adhesive is applied but not cured at that point. Then we apply the adhesive cement. Veneer is placed and excess cement is removed. Then we do the light curing for around 1 minute, that is on the facial and lingual side. Then we can check the fit using an explorer. Whereas a etched porcelain veneer, is a thin piece of porcelain that is bonded to the front of the tooth. So porcelain is a very durable, translucent, strong, natural looking and beautiful material. So the only difference in this procedure for porcelain veneer from the composite veneer is that the need to condition the internal surface of each veneer with a saline primer just before applying the resin bonding agent. So the first appointment, we have to do the veneer preparation, that is shade selection, tooth preparation, impression and temporary veneers. Whereas the second appointment, we remove the temporary one, then we do the clinical try-in and do the cementation. So tooth preparation, we have to follow this way: label reduction, interproximal reduction, then incisal modification and cervical definition. So first the depth cut of 0.5 and around 0.7 mm is made. Then uniform reduction is accomplished on the facial surface utilizing the 1 mm medium grit diamond burr. Then incisal reduction of 0.7 mm, interproximal reduction and also the contact point. Then the incisal edge preparation, beveling of the incisal 1/3 back to the lingual incisal edge. Then the lingual preparation is not necessary on all veneers. It may be utilized on the lingual aspect of the cuspid to establish the cuspid rings. So after the impression, we go for temporary veneer. The retraction cord should be left in place if possible during the impression, and we can use a polyether material. Then we create a temporary veneer. We can use a composite for temporary veneers. So in the lab section, the process will be done. And then in the second appointment, we remove the temporary restorations without damaging the margin areas of preparation. Then we do the try-in and proximal contacts will be adjusted. After that, cementation. Okay, all the procedure using a saline solution to the internal aspect of veneer, etching, rinsing and drying, then the applying of primer, then cementation, finally adjusting the occlusion. So that was all about the procedure of veneering. We have various types and it is a very common nowadays because aesthetic is of prime concern in present scenario, and we can easily design a smile with veneers. So smile designing is also a part of dental veneers. So we learned about the indirect and this direct veneer techniques. It's very commonly asked, the classification and direct veneer technique or indirect veneer techniques. So it can be a composite, process composite, or can be a etched porcelain, and it can be a processed ceramic. So that was all about dental veneers. So I'll come up with a new topic in dentistry and more. Thank you.